Typically, when we get a blood test, we give a sample to a lab and wait for the results to come to us. But what if you could sit with your practitioner and observe the live blood cells and understand exactly what they mean? Today, we asked Dr. Jenny Wilkins from AgeVital Pharmacy about live blood analysis. Wow, that sounds interesting. What does that mean? How do those blood tests work?
Well, patients will usually come in, and I love offering this to clients that don't have health insurance. I would say about 75% of this community right now, Sarasota County, is without health insurance.
Oh, wow.
Because the premiums are so high. So I offer this quick, little inexpensive, it takes about half an hour to an hour to do. But I'm going to give it for free since I'm doing it right now. I'm going to do it for this month just because there's a lot of people with nutritional deficiencies. So I'm going to offer that. It usually costs about $125 to $250.
What a deal.
Yep.
So what does it show?
We get a little, finger prick. So we do a lancet, and then we pop it right on the slide, and then from the slide on the microscope, it projects it on the screen. So then the patients actually get to see exactly what we're looking at.
Oh.
So they get to play chemist, biologist, microscopist.
So like this slide is showing what?
So
like
this is an actual patient of mine. So if you're looking at this slide right here, this is a patient that presents anemia. This person right here has a lot of autoimmune issues, but you see how the normal cells look round and full and red. You see how a lot of those little ones right there, they're clear, and you can just see the ring, and a lot of them look hollow, and they look like they have little holes in them. So that's a sign of somebody that's anemic. So a patient that comes in and saying, you know what, I have low energy, I can't sleep, my bones ache, and I'm like, well, you're anemic. The moment I look at their cells, you can tell. And then those bigger circles, those are the white blood cells. So white blood cells are so important to protect the body from different types of funguses and diseases. Now this slide right here, you see a lot of white blood cells in there, so the big round circles, but you see all the cells clustering together. Those cells clustering together. This person has terrible digestive issues, probably has IBS, has is burping, is gassy, has acid reflux, and is probably a little bit overweight. So when you see in those cells cling together, that's not a good sign.
And so in that instance, you know exactly what you should give them as far as nutrients and things like that?
Exactly. So each, a cell tells its story, and so cells are supposed to be flowing and separated and perfectly round and plump. When they're perfectly hydrated, when they're perfectly being fed antioxidants, when hormones are acting right. So a lot of, like this one right here, this one shows somebody that has a lot of hormonal abnormalities. And you can see a lot of the platelets, a lot of little, dots. You see dots on that one. But look at those red blood, the white blood cells on there. You have the Pac-Man cells, the ones that look like little Pac-Man, right? So they're going in there. So they're eating foreign bodies, in the body. So funguses, parasites, molds, free radicals, cancer cells, dead bacteria, phytotoxins, endotoxins that your body's not really supposed to have. And we're always being bombarded in our environment by, toxins, so xenoestrogens, phytoestrogens, so you rely on those white blood cells to go in there and fight your battle.
And your body shows all of this.
It shows all of it.
In the blood.
Yep, and we can magnify it 400, 800, 1,200 times. You can go even, look at inside of the white blood cell, make sure the white blood cells are looking normal as well.
What can you diagnose from this?
Let's see, digestive issues, anemia, gout, sleep disorders, problems with your adrenals, so hormonal abnormalities. You can look at cells that look mutated. They're supposed to be round, and some of them have little spikes around them, or some of them are clinging together where they're not eating healthy. They're like, oh yeah, my lifestyle is totally clean. I'm like, not according to
so
what?
much. Well, I like the
look
fact
at that cholesterol chunk there, buddy. What'd you eat for breakfast?
Oh my gosh, yeah, this may be a scary test. When you look at that, though, I like the fact that then we can choose the products smartly. So we're not buying 8 products just trying to feel better. You buy the right product, so you end up saving money because you're actually making yourself better.
And then some people have parasites. I would say about 80% of who I test have parasites going in and out of the red blood cells, eating all their nutrients. I'm like, well, no wonder you're tired.
How do you get rid
of
of
these little critters in there eating all your food.
Oh, wow. So you have...
so I have cleanses, to help them with the, parasitic cleanses, microbial cleanses. I have the vitamin, B injections, the lipomino injections. We have hormonal injections. And then if I see, abnormalities that needs further testing, I do the hormone testing to see which specific hormones are causing their cells
So
to mutate.
Good that you can see for yourself, and people can come in and meet Dr. Jenny and see for yourself if you go to AgeVital Pharmacy on Main Street or go to her website. Remember, she offered quite a deal, too.
Yeah,
free.
Yep.
It doesn't get any better than that.
We like that price.
Thank you, Dr. Jenny. And up next, we will have more information, a very exciting change coming about.